we're getting close to the end, and I want to finish with a big question, and that is really about accessibility. And we know that in this country, there's a mental health crisis. And we watch, indeed, the privilege of people who are able to devote time and resources to spending an hour or so with you and unlocking their own problems. But how should we be thinking about this mental health crisis? And how should people get access to the kind of help they need to deal with relationships and all the other issues that are making life so very difficult today?
Yeah, great question. Really great question. A few things. I'll actually say two things. I mean, one thing is that I can tell you that, for example, psychoanalytic training institutes are thinking about this matter very, very seriously and thinking about how to introduce community psychoanalysis into training and sort of make more headway in the public in terms of finding different ways to offer what we have to offer to the public. And our show is one of the many ways we're trying to do that, but really to make psychoanalysis and psychoanalytic thinking much more available. We'd have to get through the bureaucracy of managed care and the way the healthcare system in this society is structured, and which ties to the other thing I wanted to say, which is that the mental health crisis is not a thing on its own. It's an expression of what's happening in the society. It's dealing with it only on the level of mental health is missing the big picture, which is that, for example, teenagers nowadays are responding to what's happening in society. I mean, whether it's like climate crisis coming their way or the incredible divisions in terms of like the way wealth is distributed in this country and the hopelessness about like being able to tackle that, that's all contributing to the mental health crisis. And really to put it only on the level of like how the mental health profession is dealing with it is really kind of closing our eyes to what's the factor contributing.